Hi, y'all. It's Kimberly here. Thank you for coming to my channel. Well, today I want to talk about this crazy court case that happened. It involved a nurse named Radonda Vaught. She was an ICU nurse from Tennessee at the Vanderbilt University Medical Center. And in 2017, she made a medication error that caused the death of a 75-year-old woman in the ICU. She was supposed to inject her with Versed, which is a sedative, but instead she injected her with verochronium, which is a muscle relaxant. And this caused her to not be able to breathe and resulted in her death. Now, there are safeguards usually in place at hospitals or just about anywhere else that you work at. And sometimes they can be overridden through the system, through the computer or manually. And I believe it was probably through the computer system that they have, because everything is computerized nowadays in hospitals. So it was most likely, I believe, probably done through computers, which it allows a nurse to do it themselves without having to chase down a doctor or get verbal permission or written permission. So it's very easy to do that. They just click on a few tabs and override the system. And I think that this hospital, because of this system, the way that it is routinely done, to me, I believe that it puts culpability on the hospital and the administrative personnel that are aware of this and allow it to happen. So this is why I find this case that it's just insane that this nurse was charged and convicted of this. She was charged with abuse and criminally negligent homicide. Now, this is an extreme charge, especially in the medical field, because I really don't remember any doctors or nurses that were charged like this unless they were intentionally causing the deaths of patients. There was a doctor that was doing that, and I don't really remember his name. It was years ago, and he was picking out patients that he thought that were in pain or were terminally ill, and he was ending their life himself, making the decision himself to do that. And he was acquitted of that. He was never he was charged with it, but he was never convicted. So he essentially got away with murder. And there have been nurses that have been, there have been numerous nurses, I believe, that were, I think, angels of mercy, they called themselves, who did the same thing. And I believe several of them were charged, and I'm not sure how many were convicted. I don't have any numbers on that, but that does happen in the medical community, and I think some nurses or doctors take it upon themselves, to play God and to decide, when somebody's life should end according to the quality of life that the nurse or the doctor may see them, the patient, see them living in, if it's not a good quality of life to them, or if there's no hope for, if it's a terminally ill patient, if there's no hope for survival, they take it into their own hands and they do whatever they think that should be done to end the misery, the pain of that patient. And this isn't the case with Radonda Vaught. She was training a new trainee and was just overstressed. It was pre-pandemic when this happened, but still, even in those times, being a nurse, it can be very stressful, and I have a lot of respect for nurses and doctors. It's a sometimes thankless job. It's one of those jobs where you're just rushed and you're just running according to, nothing happens on a schedule. When sick people come in or people are in the hospital, you never know, when the call out's going to go off or what they want. So it can be like an extremely busy night, running around getting everything for doctors, getting things set up, getting things cleaned up, and helping patients and training new nurses. And this is, kind of what was happening to this nurse. And even though there were safeguards in place that she should have checked, there's also a warning on the vial, that they use, the top of the vial. And I believe this one had a warning. It's the little rubber stopper that they put the needle in. Around it, there's a print on it that says it's either a muscle relaxant or a sedative or something like that, or whatever the drug is. It should say something like that. And she didn't read that, and she overrode the system. And it was all, I guess, being in a hurry and not paying attention, being distracted, trying to train another trainee, keeping an eye on that person, making sure that they didn't do something wrong. And it resulted in all these things lining up and resulted in her killing a patient. And doctors do this all the time. Doctors, unbelievably, anesthesiologists and doctors, they end up killing patients all the time. I remember watching an episode of, if some of you are old enough to remember this show, Saint Elsewhere. It was about a hospital called St. Eligius, and it had Anthony Edwards in it. It had Denzel Washington, numerous other, I can't remember how many other, Juliana Margulies. There's several actors and actresses from that show that went on to really great careers. And it was one of the best medical shows on TV. I loved it. Noah Wyle was on it. And there was numerous actors and actresses on it that just had, stellar careers after this. George Clooney was on it also. And there was an episode where one of the doctors nicked an artery and caused a patient to bleed out, and he tried to cover it up. There was a recording of the surgery, and he went and got it was a cassette tape. He went and got the cassette tape, he pulled it out and ripped it to shreds, because when he reviewed the tape, he realized the patient had passed away, and he realized that he made a mistake, but he didn't remember it. He made a mistake in the surgery, and it was on it was an audio recording, and of himself describing what he was doing throughout the surgery, and he ended up nicking an artery, and that patient passed away, and he destroyed the evidence of it. So stuff like that happens all the time in hospitals, and I've spoken to nurses saying that yes, doctors make mistakes all the time and cover them up, and I've spoken to nurses that I've known saying that, some doctors are very noble and honest, and then there's some that, they're scared that they're going to lose their license, and they do try to cover things up. And this nurse, she admitted to it. She was remorseful. She took responsibility for it, and she was charged with abuse and criminally negligent homicide, but she was convicted of gross neglect and negligent homicide, and she received 3 years probation just last week, or just a few days ago. And to me, I think it's setting a very like a dangerous precedent for nurses. Who would want to be a nurse at this time? If you know that you make a mistake and you report it, you could be charged criminally and go to jail. And with nurses being overworked and in the middle of a pandemic, I think it was more like using her as a scapegoat. And just out of the blue, this one nurse gets charged with this, even though I feel greatly for the family that of the person that passed away. I do. But for one nurse to be picked out of all the doctors, of all the cases that of people who have intentionally inflicted harm on patients, this was an accident. This was not something that she did out of a behavioral problem or something intentionally because she was mad at a patient. This is from her being just distracted and probably overworked and being rushed and making a mistake. One mistake. It was a simple mistake, had a horrific outcome, but to charge her criminally, I think that was just, there's got to be something behind. I really believe there was something behind it, because even the family said that they forgave her, and they also said that they believed that this woman would have forgiven her for her actions. And I do think that the hospital is very culpable for this because of the condition that they put nurses in, and the idea that they would make a corrective plan after this happened. They made a corrective plan. This one hospital did in 2018, made a corrective plan of action to circumvent anything like this ever happening again. To me, that leads to culpability because they're aware that there was something wrong in their system and in the way that they routinely did things. So after she gets charged, she's the only one that got charged. None of the administrators, nobody else was even brought up on charges or anything, especially with the system being allowed to be overridden. I believe people who were aware of it and allowed it to happen, because they really needed some kind of permission. To me, I believe permission was one of the biggest, I can't think of the right word, but for them to be given permission to override something would have probably stopped this, because the doctor would have had to check, the vial, or either made her check the vial and read it off to him. So there's many checks that could have been done to prevent this, and none of it occurred because it was allowed to be overridden. So when they have a situation like that, that's just asking for something to happen. That's asking for an accident to happen. And this, without even being intentionally done, there's such an open door for something to happen when you allow stuff like this to go on without permission, or making sure that it cannot be overridden manually or without permission. Well, that's what I think about it. I think it's just outrageous that they charged her criminally. Maybe if they would have charged her with manslaughter or something with lesser, just without the criminally negligent wording in it, because I find to me it's just completely outrageous. I would never want to be a nurse in this time. And the ANA, the Nursing Association, was very upset about this ruling. There were hundreds of nurses that were outside the hospital supporting her in the courtroom, and nurses across the nation now, I think there's going to be a lot of thought to whether they're going to retire early or not even want to be a nurse anymore. I do believe this might really weigh heavy on a lot of nurses' minds, because a lot of nurses have already quit because of the pandemic alone, just from being overworked and being just exhausted. And then add on top of that, if I make a mistake because I'm so exhausted that I could be criminally charged, I think it will make a lot of nurses think twice about the career choice that they have. Okay, thank you all for coming to my channel. Thank you so much, and y'all have a good day.